Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello and welcome to this edition of the Healthcare Connections podcast. I am your host, Jeremy Winn, the Director of Sales here at Healthcare Compliance Pros. Today, I've brought on one of my favorite people in the entire world. I'm certainly biased, so sorry about that, but one of our own here from Healthcare Compliance Pros. I've got Jake Yates. He's one of our compliance officers. Jake, thank you so much for joining today.
Yeah, absolutely. Thrilled to be asked back, Jeremy. Thanks for asking me.
Yeah, so why don't you go ahead for those if they didn't hear an episode we've done or aren't familiar with you, give a brief introduction of yourself to the
Yeah,
audience.
absolutely. So I'm one of the compliance officers here at HCP. So I work with our customers answering compliance questions, helping them mitigate situations, things like that. My background was primarily in medical record retrieval and Medicare audits. And then over the years has kind of morphed into risk adjustment to compliance now. And I absolutely love what I do. Compliance is such a fun area of healthcare to work in. So I, over the last couple of years, have been working on some certifications, earned my CHC from the Healthcare Compliance Board a few years ago, and then actually just within the last week or so, earned my Artificial Intelligence Professional in Healthcare Compliance certification as part of the founding cohort of that certification. And not to, put too much on me, but was the 20th person to get this certification in the world. So I'm feeling pretty good about it right now. But
Hey, go ahead and dust those shoulders off. You know what I mean? Like that's so cool. That was actually one of the things that sparked me wanting to bring you on, Jake, as we kind of celebrated your achievement here in our organization and kind of all virtually cheered for you over Zoom as you completed this certification. I was at the HIMSS conference in Vegas, just last week, as of this recording, and so one of the things that I mean, it was everywhere. It kind of was overwhelming all day long for 3 days. Was AI this, AI that? How are you using AI? We want to use AI. You're a compliance company. How do we do it right? And I mean, no, that's not a surprise to anybody listening to this. The AI is the dominating factor, not just in healthcare, but we're seeing it in our society. Everybody's trying to wrap their head around AI. What does it mean? What can it do for us? The dangers, the opportunities. I mean, it's all over. So I thought this would be really timely with you completing the certification to say, let's bring Jake on. Let's talk about some of the high level hot topics for those that are navigating this new technology and phenomenon. So, Jake, I'm excited, and hopefully you're ready for some of my questions today.
oh, I'm ready. Let's do it.
Okay, so let's just start. I think high level, because this comes up the most from a compliance perspective, is they want to look at risk, right? So we get this a lot. What are you seeing when it comes to healthcare and AI? What are some of the riskiest use cases that organizations are facing today where they're trying to implement AI?
Yeah. So one of the, I guess you can kind of break it down into three categories: your high, moderate, and low risks. And in different areas of healthcare, that risk varies. The highest potential for harm is with patient safety and treatment.
Mm-hmm.
There's so many instances in which if there's not consistent monitoring, a lot of those AI tools can actually produce more harm than good. But that being said, if they are regularly monitored with good audit capability and functionality and good insight, they can be tremendous tools that are really absolutely changing the way healthcare operates today. But when we think of things like generative AI is famous for this, with things like hallucinations and
Yeah.
creating biases, that is still functionality that can happen even in these robust systems that are basically helping providers treat patients.
Hmm.
And that, again, has its own set of issues that can cause in a clinical setting. The other piece of it that we think about is how AI draws its conclusions. AI is only putting out what we're putting in.
Yep.
So if we're using poor data or data that doesn't represent a um, really holistic demographic, we're giving an unfair advantage in the type of care received by patients. So there's a lot that's going on in the background, especially as it relates to patient care. Then, as we look at like the moderate and low risks, we're thinking areas like billing and coding, where it's not
Mhm.
necessarily going to impact a patient's life per se, but can also have its own set of risks.
Yeah.
Then we look at unbundling code sets. We look at overpayments happening, or the AI adding information in or assuming information in a provider's notes. And then again, we have our problem with overbilling there too. So it all just kind of, it's the concepts and ideas are great, but it needs to be monitored and really honed in and carefully monitored by an organization, really, to make it effective and helpful.
Absolutely. Before you jump into maybe some of the other stuff, I'll give it an example on the coding side. We had a client come to us, and I won't mention the EHR system or anything that they were using, but they were really concerned with some of the AI functionality as it was trying to teach and to take information and determine what code sets should be used for billing. They were getting a little bit nervous, like, is this doing it right? They were relying on it heavily. So they asked us to come in and do an audit, a post audit, to look at the results of the AI tool and how it was, teaching and telling the organization to code. And we actually found pretty significant errors. And it wasn't even, it was kind of both sides. There were situations where it was asking the organization to overcode, and documentation, medical necessity really wasn't fully there. We also found situations where it was actually undercoding. And so it was both sides of the aisle. And so there are some great efficiencies with some of these technologies. But to your point, you really still need to keep eyes on them. There still needs to be a human element at some point to verify, to check somewhere along your processes, wherever you might be using it. That was just one example recently that we came across.
Yeah, absolutely. And I mean, when we even look at AI and the use of coding, I worked at an organization back in 2014 that was already exploring that type of functionality. And we didn't even have any client takers that would even be willing to let us utilize or try the software we were building to be able to do that.
Yeah.
And even now, what, more than 10 years later, there's still so much fine tuning that needs to happen. It's better, but there's still so much oversight you've got to have into those things to make sure you're not causing more problems for yourself.
Definitely. Yep. It's the old adage, trust but verify. I mean,
Exactly.
yeah,
Yeah.
don't fully
Yeah.
trust the AI tools yet. You still got to verify at some point. Anyway, I didn't mean to interrupt because you were kind of talking to the high, the moderate risks. I didn't know
Yeah.
if you had any other examples on that first question.
Yeah, no, and really with kind of the low risk, again, that's going to be our generative AI. So
Hmm.
a lot of the kind of scheduling tasks, writing responses, things like that, the things that really don't pose a lot of risk, but in some ways can. One of the cases that we see a lot of is individuals that are, or even providers for that matter, that are trying to update their notes, have AI help generate a summary or things like that, and put patient information in there or information that could identify a patient. So there's a lot of these areas that we just have to be really careful about. We've even seen use cases where individuals have just not even said a word that they're using like chat gpt to help in their jobs. So there's also the shadow use of AI
Hmm.
that's creating compliance risks and potentially putting patient data out there, and no one in the office knows about it because no one's speaking up and saying anything about it. So there's a lot of different risk areas we really have to look at and make sure that we understand and have the appropriate safeguards in place when we're using these AI systems, even down to something as simple as generative AI.
Yeah. Okay. That's great information. So I think that leads into maybe my second question here, because again, being at HIMSS, I don't know if there was a single vendor booth that didn't try and say AI in some way. And so, again, so for those that are navigating, trying to, again, I think it's great that that people are trying to find tools, because there are some great use cases to help bring efficiency. And again, with the overall goal in healthcare to lower cost, if you can bring efficiencies into healthcare, hopefully it can bring efficiencies that drive costs down for patients, right? So,
Yeah.
for those organizations that are vetting out vendors and you're looking to use a vendor for something, what are some considerations that you would recommend to our audience that they look into as they're vetting out these different services?
Yeah, great question. And that's one that we can address in so many different ways. So I'll boil it down to, I guess we'll say, the top three things to consider. The first is just be aware of marketing.
Hmm.
Marketing is a powerful tool. There are so many, like you said, so many vendors out there that are touting their use of AI, things like that. Just remember that any of those claims have to be truthful and substantiated about what their product can actually do and what it can't do. So they have to disclose any of those caveats, qualifications, limitations, anything like that to anyone who might utilize that product. And that's not just like a best practice, that's actually a federally regulated part of the Federal Trade Commission Act. So if someone's marketing something with their product using AI and it doesn't actually do what it's saying, or they don't disclose those caveats up front, they're actually violating federal law by making those claims.
Yeah.
And we could do a whole podcast, we could do a whole webinar just on that. But I'll leave that to bed for now. The other one is a lack of transparency on their AI model and the different decision making capabilities that it makes. I mean, again, we can kind of look from the high to the low in how that can impact a healthcare organization. But I always caution, if a vendor's not willing to share information on how their AI model is really making certain decisions or why it's suggesting certain things, it's best to stay away from that vendor. Um, I, I'll just blanket kind of say that. I mean, we would expect, especially with as big as AI is right now, there's going to be proprietary information. There's going to be
Right.
trade secrets they're not going to want to share. But if they are being overly secretive or not making any attempt to try and share information with you, that's a good sign to not use that vendor. Because if they're not willing, honestly, to provide enough transparency for your risk management and your satisfaction, there's no point to using them, because more likely than not, there's something happening in the background that could later reflect or injure your organization.
Great.
The last thing I would caution is just to read vendor agreements very carefully if you're going to be using any type of AI with that vendor. One of the things that we're starting to see is there are, we'll say, sneaky little clauses added in there that don't always make it so covered entities or healthcare practices know when an AI model is updated or when the data is put in and retrained the AI system. So it can impact different areas. We've seen use cases where the AI functionality was updated. No healthcare organizations using that AI were informed about it, and it having a direct impact on patient safety and care.
Yeah.
So there's all of those little areas we've just got to watch out for. So again, it kind of comes back to that transparency piece. Read those agreements very carefully and make sure that they're to your organization's liking and risk tolerance
Right.
threshold. We really just want to make sure that if they're going to change around their AI models, how it's learning, how it's adapting, we want to know about those things before they get released. Otherwise, we can find ourselves in a whole heap of trouble and even look at potential injury to patients.
Yeah. I think a big thing is who's liable if the AI goes off course.
Yeah, exactly.
And make sure
Exactly.
that liability sits on the vendor. and that you
Exactly.
can pass liability onto the vendor. Just really protect yourself is always good advice, but especially again as AI can do funny things still.
Yes.
So okay, so let's maybe and we don't have to put an exact number on this, but maybe three. Let's start with three. What are some of the top three risks? We'll start with that. A healthcare organization should consider when they're using AI.
Great. And I have the perfect first one, and that is over trusting AI responses. Again, we can look at that from high use cases to low
Mm-hmm.
risk cases. We've seen cases where providers, experienced providers who have had years, if not decades of practical medical experience, know their trade, know what they're doing, start questioning themselves because of how AI responds to them in
Yeah.
certain situations. To me, that's terrifying. That's dangerous. When we have a clinician that is well versed in their specialty that suddenly is using these decades of experiences that they've had that have taught them what works and what doesn't, and are actually considering the AI to, I guess, for lack of a better word, almost considering the AI more intelligent than them just because it spits out a different response than what they would have suggested. So there's a lot of concern, especially in the compliance world, about these responses that are teaching clinicians or making clinicians doubt themselves, again, then leading to patient harm. And it goes back to some of the other things we talked about. If we don't know where the AI is getting the data from,
Right.
it could easily be feeding us false information and making it seem completely plausible and completely real. And again, that works from patient treatment all the way down to just regular generative AI.
Great. Okay, so we're coming up on time here.
Okay.
So for those that are listening, and they're like, okay, I'm using AI now, and now you got me a little freaked out, Jake. Um,
Don't be freaked out. Don't be freaked out.
what's a simple? I mean, if it would this was somebody you were talking to, right, a client, and you're like, okay, you're using AI. What's one step you would suggest they could do today to just ensure they're on the roadmap to protecting themselves? That's how I'll ask that. How's that?
Okay. Great question. Really, it comes down to this: putting your safeguards in place. Safeguards can start with something as simple as policies and procedures
Yeah.
or training. Just making sure people are aware of what your organization's limits are and helping steer people to fall within safe boundaries when using AI. I mean, from there we can expand that to any
Right.
specific kind of direction, but when we look at effective compliance programs, especially, that's really the base of the pyramid. That's where everything starts, is with training and those policies and procedures to help guide the organization to compliance practices.
Love it. Somehow I knew you were going to go there with policies and procedures. And there's a reason, because it's always the first question. When something goes wrong, the
Yep.
first question from any agency, anybody that's coming in to audit you is, we want to see your policies, procedures. Do you have them? And so, again, for a great first step, if you don't have a policy around AI and how you're using it as an organization, you need to create one. If you need help creating one, that's where we come in. So, awesome. Jake, so much fun. Love having you on as always. Appreciate you being on the episode today. And we will do this again.
Oh, I have so much more I can share. So
20 minutes is not enough on this topic. So, but thank you so much. I think this is really good kind of intro, high level information to get people thinking and starting to consider how they can again protect themselves. That's what we want to do for our clients and for everybody out there. Even if you're not a client, we want to help you learn how to protect yourself. So thank you, Jake. Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.